Today I am going to speak on one more important issue which is quite unspoken in diabetics. Actually, for that matter, this is not only for diabetics, this can apply to all the general population. I would begin with a question: how often do you think you have bloated stomach, gases, acidity, irritations, passing gases, or disturbed bowel especially, like loose motions, constipation, sticky stools? And every time you go to your doctor, he feels that it is some infection because you have eaten outside, and he just treats you with some antibiotics or anti-helminthic medications or anti-protozoal medicines. You don't get better, or you get better for a while, and then again those symptoms recur. Have you ever noticed that these symptoms happen when you are working, when you are stressed, when you have certain targets? And these symptoms disappear when you go for a foreign vacation, or to your native place, or somewhere where you don't have stress. Do you understand that the bowel, the gut, is closely controlled by our mind? You must have heard a small kid saying पेट में दुखता है when he is asked to go to school. So is he bluffing? He is actually not bluffing. Whenever he doesn't want to do something and you enforce something on him, like go to school, he starts getting that abdominal cramps. This is a normal reflex which every human has. So as we grow and we become elderly or adults, and whenever we have stress, a good number of patients cannot handle this stress, and they will start having all this good sort of movement or some acidity or all these symptoms, and they will get loose motions and all. These symptoms are directly related to stress, and this disorder is called as Irritable Bowel Syndrome. If you think Irritable Bowel Syndrome is uncommon, let me tell you that 10 to 15% of the general population, I am not talking about diabetics, general population suffer with Irritable Bowel Syndrome. In diabetics, it's all the more common. The bigger problem is it often is confused with infectious diseases or some other problem. Diabetics are prone to a lot of other problems like ischemic colitis, Crohn's disease, ulcerative colitis, which are other problems which can happen. And because of IBS being present, many a times it is either misdiagnosed or it is just forgotten. It is very important to bring all these points to your notice of your doctor so that he takes heed of it, pays attention to it, and treats you better. Thank you.